Hello everyone, I am Tejeshwar Jain and I'm here to share our findings on prescription practices of PERT for pancreatic cancer patients among pancreatic surgeons in the US. The authors have no conflicts of interest to declare. PEI or pancreatic exocrine insufficiency can exist in a significant number of PDAC patients preoperatively and can increase even further postoperatively. PERT or enzyme replacement therapy is the treatment of choice for exocrine insufficiency. However, in the setting of PDAC, there are no evidence-based guidelines to inform its clinical use, leading to wide variations in clinical practice. Therefore, we designed the study to evaluate the prescription practices of the treating physicians with regards to PERT in PDAC. We disseminated an online anonymous survey to members of the AHPBA and the Pancreas Club and were able to record 208 unique responses. A majority of our respondents identified their practice as university academic and had annual PDAC surgical volumes of more than 20. Only 13.5% of the respondents stated that they never used PERT for PDAC cases in their practice, while amongst the users, majority preferred to use PERT in selective case-by-case basis. We observed that annual PDAC surgical volumes of more than 20 were associated with greater PERT use, and surgeons preferred to use PERT for patients getting upfront pancreaticoduodenectomies as compared to those getting distal pancreatectomies or neoadjuvant therapy. And this is quite logical, as studies have already shown that cases requiring pancreaticoduodenectomies are at an increased risk of exocrine insufficiency preoperatively as well as postoperatively. We also observed that surgeons infrequently utilized lab tests to establish PEI before initiating PERT or to check for adequacy of therapy once PERT was initiated. It should be noted that few surgeons repeated fecal elastase 1 to check for adequacy of therapy, but this might give confounding results as this test measures human elastase while PERT has porcine or bovine elastase. It's also interesting to note that while most of the surgeons do use PERT for some cases of PDAC, majority of them do not believe that it can improve overall survival or disease-free survival. It should also be noted that there are a significant number of surgeons who are still undecided over the effects of PERT on PDAC outcomes. Ours is the first study evaluating prescription practices of PERT in PDAC, and we observed that majority of the surgeons use PERT for at least some cases of PDAC with surgical volumes of more than 20 per year associated with greater PERT use. There is inconsistent testing before and follow-up after initiation of PERT, possibly reflecting a lack of confidence in existing lab tests. Views on effect of PERT on PDAC outcomes can influence prescription practices. However, most of the surgeons are still undecided over the effects of PERT on PDAC outcomes. Therefore, well-designed prospective studies are required to evaluate the effects of PERT on PDAC outcomes. Thank you.